Oh, good morning, everybody. Stephen, my name. I'm calling from Cambridge here. I'm sure you're in various different parts of the east of England at the moment. We're here this morning to run through a live demonstration of the Life Quality Improvement Platform. So welcome, everybody. I'm the clinical lead for the Patient Safety Collaborative here at the Eastern Academic Health Science Network, and I'm also clinical governance lead at Papworth Hospital. I'll be talking a little bit about some of the quality improvement work that we've done at Papworth using Life. But I've got a great team around me this morning, so they'll introduce themselves, and we're going to start running through the webinar.
Morning, my name's Calum. Worsley. I'm a medical student at Cambridge, and I've been at Papworth for coming up to a year now, working with Stephen and others on the projects that have been going at Papworth, and I've been introducing myself and others to Life as we've gone along in the way that that's improved the work that we've been able to do.
Good morning, my name's Lucy Mitchell. I'm one of the improvement coaches here at the Academic Health Science Network, and I'll be monitoring the question box. So if you have questions as we go along, please type them into the chat box, and we'll try and answer them as best as we can as we go along.
Thanks, Calum, and thanks, Lucy, and thanks to the rest of the team that we've got around us as well to help run the webinar this morning. So to say a few words at the start about why we think Life is helpful and why it's been useful to us at Papworth. We've been involved in quality improvement work for the past few years at Papworth. We've been using the Sign Up to Safety national initiative to run our quality improvement projects. But like everybody, we've had problems with measurement. How do you measure things over time? How do you actually see improvements? How do you structure your quality improvement projects in the way that we all know we should do them, with aims, PDSA cycles, driver diagrams? Or how do you measure improvement over time using other improvement methodologies, whether that be lean or other approaches? All have problems with measurement, and you all know that measurement is so important for any form of improvement work. Then we came across Life. And I have to say that the unique selling point for Life, the fact that it is a tool that is easy to use, that is directly focused and orientated around improvement, actually helps you make improvements as you go along, and it helps you, pushes you, nudges you in the right direction to structure your improvement projects in the right way. So I find it extremely useful. To say we're not experts at all in the tool. We're not software developers or IT geeks. We're simply users who have found the tool useful and are using it with trial and error as we go along in a very practical way. That we're going to talk to you about this morning. So what we're going to do now is we're going to move on and give you some specific examples of what Life can do. So move right on to the next slide. Hopefully you'll be able to see the slides as they move forward. Another thing to say is that if you have any questions or comments during the webinar, please let us know about those. You can use the chat box, and Lucy is manning the chat box and is ready for floods of chats to come in. Have we had any so far, Lucy?
Not so far, no.
Okay, so keep coming, guys. We're looking for more chat, please. So let us know what we're doing well, what we're not doing well, questions and comments as we go along.
Okay, hopefully you should be able to see the Life landing page. So this is me logged in, and some of the projects that we've going at Papworth and that I'm active in. What I'm going to show you first of all is a way to get data that you've already got into Life, and we're going to do that through the example of the Matching Michigan infection prevention work that's been going on at Papworth for some years. And it's been going on since 2011, well before life came into existence. So for a while, this data has all been collected, but it's just sat in Excel. And Excel's fantastic. It's been around for ages. It will be around for hundreds of years more, no doubt. But it sits there, and it's on someone's drive, and it doesn't really ever get looked at. So I'm sure you guys have all got data that is similar, data that you've been collecting and have just been storing. Life is a great way to get that data out of a single document and into somewhere that can be shared among lots of people in your organization to see lots of people's different views on things and get lots of people involved. Here's a way of getting that data out of Excel and into your projects. We've got the system, and if you can get life up, go to qisystem.com, have a look around the projects there if you're able, so you can follow this as you go. What we'll do is we're going to make a new chart. So we've got a measures tab here, and we've got a test measure that I've just made so that we show you the import. It's the same as the one above, but just for demonstration purposes, we'll go to these charts. We're going to add a new chart here. The charting software is a real selling point of this, because what it does is it talks you through, if you're not used to what you're doing, how to use the charts properly and how to pick one that you need to use. So this I button gives you a flow chart, and actually this has dug us at a couple of corners where we thought we were doing things right. We found out we weren't after we went to chart things. The base chart you should use, though, is a run chart, and this will take all the data that you have and move it into proper stuff. So because what we've done with this data is the central line data. If I get it up, can you see that? Going to Excel, hopefully you can see this. In the background, I'm just going to copy a series of columns from Excel, and it's as easy as this, if only we could show you. If you get the data that you need in a file, no, it's not going to come up.
No, what we're doing at the moment is we're just demonstrating. We've got the Life QI system open, which is an internet-based system, which is obviously a web page. And Calum has also gone into Excel spreadsheet. We were hoping to show that as well, but what he's done is he's copied and is going to put this mail back into the online Life tool.
Of this is to show that a simple copy and paste gets the data out of Excel and into a chart. Once you've done that, save it, and a chart like this is displayed. It is improvement type chart. It will show you the variation in your system. It will show you shifts and trends and things that you don't normally get in Excel. This chart's quite hard to make in Excel. The software makes it much easier to do. And done with a simple copy and paste from Excel into this. Now, once here, if you get at the top, you can add data just as the month's by. So the next month of data, click on the full data sheet, go to the bottom, add in your next row. And you've already got a system where you can add month by month to data that you've already got, and it'll update the chart as it goes. I'm familiar with things like shifts and trends and improvement. The software will highlight places where that happened. Also allow you to change the chart as you've gone. So this was about where our work started. You can see a sort of period of high variation and moving back into to improved work. If I show you the other chart, you can see where we've had and we've moved on. So these little marks up here are where we did PDSA cycles. These are back in 2010 and 2011 in Papworth to change the way in which central lines were put in, to put in bundles to try and reduce infection, standardized procedures and things like that. And you can see, as we've done it, the CVC insertion checklist done here, and you can see after that things improved. You can also change how, so you tell the system that this is the baseline period, this is the test phase, and if you test period, you can ask it to regulate the limits, and it will show you the difference that you've had between the baseline period and the test phase. So you see visually that things have improved between the part before, part after, and that track things every time.
So I think that Calum has really nicely demonstrated here how we have used the QI tool to look specifically at our Matching Michigan work here at Papworth. Now, if you've got if you're familiar with improvement work you've done at any time in intensive care, you'll be familiar with the Matching Michigan project that's been around for a long time. It was introduced 5 or 6 years ago to try and replicate some of the excellent improvement work that had been done in Michigan by Peter Provenost, who incidentally was in Cambridge last week and gave an excellent talk about the improvement work that he's done and that he's moving on to demonstrate. So we've simply, using Matching Michigan as an example, weren't using QI at the time, we weren't using Life Tool at the time we were doing this work, but by putting the data in, we can see even more clearly. We knew that we'd made an improvement, but we can see even more clearly the improvements that we've made over time by introducing checklists, by changing team culture within the intensive care units, so by using a range of technical and non-technical interventions. I see that occasionally things do so well and we have a blip and where infections recur, then we improve things again over time and see that the rates of infections really have remained low compared to what they were previously. So a really nice demonstration showing again an improvement over time based on the interventions that we put into place.
A quick check, do we have any questions that have come in? No, in which case, one of the projects that we've used Life as a kind of back retrofitting, really, taking a project that we've done in the past and doing it back into Life. I'm going to do something else we've been doing in Papworth, trying to reduce the incidence of perioperative stroke or intracranial events that are in a surgical patients. And this thing that's kind of kickstarted around the time that we started using Life. So this is something that's come along as we've been using it and using Life in the way that it's intended to. One of the things that Life does is it makes it easy for you to bring all the parts of quality improvement into your project and have them all in one. So it encourages you to create driver diagrams, to link your drivers together and link them to change ideas as well. We're inventive with this, they color code very nicely. We've just got one color here, but actually if you want to split things up and show different parts that a project's going to be, it's very easy to separate that out nicely. Drivers all linked to change ideas as well. You can have these all in place and move them up and down with priorities if necessary. But that's great if you've got lots of people working on a project. This is a place for people to put things down, something that can be discussed between lots of different people, gets it out there and into a kind of collaborative space rather than sitting on a shared drive somewhere. Once you change ideas, PDA cycles are easy to put in, and adding new PDSA cycles, the form takes you through lots of different things that you should be doing. So you set your aims, work out when you want to do it. The plan comes with a list of tasks that you can direct to other people who are also working on the project. Some collaboration within this. And really think about plan, do, study, act to make your improvement much more effective and make it you use all these things that we know we should be doing, and often just skip over when we're not being so careful about doing it. It out very clearly things that you want to measure in terms of process, outcome, balancing measures, and once within that, use the charting software to get lots of different things. So we've got a variety of charts in here. Not only have we got, if I show you this one here, this is a run chart like the one that we've had before. This is simply the proportion of patients throughout separate months who had events, and we thought that may show the whole story. And one of the things that the charting software suggested that we do was, rather than show the proportion of quite a event that was happening, try showing the cases between patients who have had things. So this is essentially the same data shown differently to show the number of cases between events that have happened. And rather than looking to the number as low as possible, you want to be in cases like this, where you've gone several hundred patients between things going wrong. That this is different, rather that it's a more effective way of showing the same kind of data in a new way that will perhaps engage people more. And the charts all give you more information about the kind of things that you want to be doing, to be using these data for, whether you're charting continuous or discrete data, and it gives you examples of where, if you want to chart 4,000 admissions, this is the kind of chart that you want to use. So this is one of the places where we just sort of threw ourselves in and said, look, what does the chart think we should be using? Can we use this? People have fed back very positively about the fact that we're doing this in different ways.
Well, so Calum, can we just go back to the driver diagram again? Because I think your point about using the QI tool to actually guide you through a quality improvement project in real time is really, really important. So first example, Matching Michigan, quality improvement project that's been going on for several years, putting our data in retrospectively and producing a nice run diagram. Here, using the Life QI tool in real time has really been hugely helpful for us and really powerful to engage the rest of the team, actually show people the improvements that we've been making over time. So definitely encourage you to use the tool in this way. We have found by setting our aims clearly, putting that into the Life QI, setting our primary drivers, secondary drivers, change ideas, and PDSAs has been very helpful. The background to this particular project is that Papworth Hospital is a specialist centre. We are doing a lot of cardiothoracic surgery. We know that our mortality outcome for cardiac surgery is extremely good, one of the best in the country. But what we didn't know an awful lot about was our complications. We knew that complications happened, but really wanted to know more about how often they happened, and we wanted to be able to measure those over time. So we chose some significant complications. We've chosen a particularly high-risk type of surgery, in this case aortic surgery, and we've been looking at the incidence of stroke in aortic surgery and also in other types of cardiac surgery. And you can see how we got our primary diagrams to understand culture, to change and reorganize our morbidity and mortality meetings, look at the thresholds for reporting harm and safety incidents when they occur, and then from that we developed a suite of secondary drivers and change ideas, leading us to where we are at the moment, where we've got continuous monthly measurement of stroke and other complications over time. So by using this process, it guided us clearly through the quality improvement project and helped us as we gone along. Calum's points about how we've actually changed our measurements has helpful. Not our experts in measurement unless you have a degree in measurement from the University of Measurement, and in fact using the tool helps you to say, okay, so if the events that you're measuring are frequent, use this chart. If the events that you're measuring are not so frequent, use this chart. And so that's why we've been able to present the data in different ways. And having a group of cardiac surgeons, anaesthetists, perfusionists, scrub nurses, ODPs in the room, presenting this information on a monthly basis in real time. So we're not presenting data that was 6 months ago. It was last month. We find that very powerful to be able to show the improvements that we're making over time and actually discuss the patients specifically who've suffered harm in recent times. So using this approach has been really helpful to engage with the whole team and get everybody focused on the importance of measurement. At Papworth, we find this approach so helpful that we're actually rolling out this approach beyond just cardiac surgery to each one of our clinical specialty groups, so that each one of our clinical specialty groups will be developing their own suite of harm measures, complications specific to their area that they will again be measuring over time using the life tool to help with that.
And having things centrally like this encourages that kind of month by month and presentation of data. Because if it's lost in the if it only comes out once a year to say this is how we've done over time, this is the number that we've had, you lose the effect of saying, well, shoot score this month, what was it last month? Was it good? Was it 20 before? Was it 0 before? By showing by showing things compared to how they've been in the past, and in real time, you can see, well, look, we're getting worse. How do we sort this? Or, you know what, these things that we've tried before are getting better. And it's linked, and you can see a relationship between that and between the things that we have just done. You can do the chart, you can do that just by saying, look, this is what we've been doing in the past month, and things are getting better. Well done, carry on, keep up the good work, and we're going to change things more and more.
Okay. So, have we got anything else to show on that particular project? I think we've gone through that project in some detail. So, Lucy, is there anything you want to pick up on how the tool can be used in practice, and anything else you want to share with us at this stage?
No, I think it's just important to note that access our projects, you can look around other projects just going on to the Life tool once you've registered and come through the network, and it's a good idea to have a look and see how this may fit into what you're planning to do, and just before you get started, or as Stephen said, most of you will have projects on the go already, and just to see how this might help you to share within your network of people, rather than just having it based on an Excel spreadsheet on somebody's computer and sending around different versions. This gives you a chance to look and see what the different measures and PDSA cycles that could be done just using the improvement methodology.
Thanks, Lucy. So what Calum is demonstrating now for us is the fact that there is a huge reservoir of projects out there which can all be looked at in varying degrees of detail. There are different privacy settings, but we would encourage people to be as open as possible with their projects. And in fact, we can look at one that has been done outside our region and look at it in a bit more detail. So Cal's going to talk us through another one now.
Anything that we want to look at in particular, you can look at in here. So I know, well, let's see, we want to see something about falls, and there's all sorts. So we've got lots and lots of projects that have been looking at falls, and these are projects that have been done around the region, and lots of these projects are open for people to have a look at, to see, you know, how has people's things worked, what kind of ideas have people had to improve those things, and whether those things have worked. See whether those things might be applicable to a region. See what they might be the kind of you could see yourself doing. These are a panacea. Not everything will work, you know, one organisation to the next. By working, by sharing the work that you do and collaborating as widely widely as you can share those ideas, get feedback on whether they work or not, and if they work well, say, show people, look, this worked very well for us, this may work very well for your patients. It's worth saying that if you're or don't want to be kind of sharing this quite so widely, the tool isn't set up to need to take any identifiable data. It only takes the bare minimum statistics to say this is how many happened, this is how many patients we have, the number of admissions we had, the denominator as it were, and this is the month that it was required in. You don't need to give the software the raw data, and you can lock the project down so that non-NHS staff can't see it, or that people outside your organisation can't see it if you require that. But as we'd encourage you to share things as widely as you can, because that kind of collaboration is one of the of this, one of the things that will make sure that you and other people get them out of your work and the other work that's being done around the region.
Yeah, absolutely. So that's a really important point. The importance of sharing and collaboration is key. That's why we can have access to other projects and have a look at them. But just to emphasize that the tool does not take patient identifiable information. So your information is safe. There's no patient identifiable information. What we're simply looking for, what the tool simply uses is categories and counting. So this is an opportunity to put your information in a non-identifiable way and then generate run charts, PDSA cycles, driver diagrams, and so on from that information. So, does anyone is anyone else in the region an opportunity for you to use the chat box? Anyone else using the tool at the moment, or does anyone else have any tips that they want to share with the rest of the group? Use the chat box or speak to us indeed. What I'd recommend is simply just get on to the website yourself, have a look at it, and see how it may be useful to you. Have a look at all the projects that are available, the projects that we've done at Papworth, the projects within the region, and the tool is freely available to your organisation within the East of England through the Eastern Academic Health Science Network. We're available for help in getting set up and registered on the project. Please contact us in using the tool. Please contact us directly for more information. Within the tool itself, there are lots of resources and information. We've simply today demonstrated how we have used it in our particular location in Papworth. In terms of the actual nitty-gritty, how to use it, more detailed information, then the best place to go is the website itself, where the resources are stored, or indeed to contact us, and we can put you in touch with more specific questions that you may have from software developers. The tool itself, was developed by one of our colleague patient safety collaboratives, so the West Essex Patient Safety Collaborative. Southwest, I beg your pardon, Southwest Patient Safety Collaborative, and they've obviously used and tested the tool in more detail than we have. And again, we can put you in contact with lots of other people who have used the tool in more detail for further information.
And there is on the website are reasonably specific in what they want to do. This guide here, Guide to the Life System, is a very good and quite concise overview of the ways that you'll be able to use it. But I'd encourage you just to dive in and have a go. It's really very self-explanatory and has been designed, hopefully, to be very usable to people who have a reasonable idea of what quality imprint should look like, but aren't necessarily savvy isn't required here. And just by going in and using is the way that we've found how to use it. We'd encourage you guys to do it as well. There is help there on the website and help elsewhere, as Stephen has just explained.
Okay. Good. I think that the main point for today was to be able to demonstrate the two to you. We've got some discussion coming up there. Nicola, what's the chat coming through?
Questions here. If we just kick off with them. So somebody's asking, how widely do you share the information? Is it largely between clinical staff or also for reporting at Trust Board? A combination, and it can be used for any of those purposes. For regular reporting to clinical staff, and for reporting at a high level to the morbidity and mortality meeting that this was kind of set up for, charts can all be exported as PDFs or images and just dropped into PowerPoints, so it can be presented quite easily there. For sharing between clinical staff, we encourage as many people as want to get signed up to Life, to log in and to participate in active use. But for presenting to other places for reporting purposes, it's useful for us as well, in so much as the charts can just be taken straight from the website and put into presentations as you need.
Yeah, so absolutely. That question has come from Mark. Yeah, so I think that's a really good question. We have shared the information at both the morbidity and mortality meetings, as Calum has said, and also at board level. So two things that are important. One is that each of the graphs, charts can be downloaded to a PowerPoint presentation. It will be downloaded as an image, and then that image can be directly put into a presentation, which is useful at an M&M meeting. And also the driver diagrams can also be downloaded again as an image. And in fact, I presented our driver diagrams at board meetings to demonstrate how we are going to organise and structure our improvement plan. Question is, what's the next one? Okay, how is the chart embedded? Can we explain again? Do you want to just run through that again, Calum, who's explain how we did that?
Sure.
This is going to be recorded and will be available on our website. If anyone wants to go back through the presentation again, it will be there for you to pick up offline as well.
Great, thank you very much. So really important point. Everything we're saying today will be recorded for posterity and put on the website, so we can go and you can pick up if you missed anything as we went along. What we'll do, we're just going to do a really just demonstration of how we did that again, or just to show how we imported the data, just where it would go to.
So to set up a new chart, you need to set a new measure. You can call whatever you want. We'll just call it a test one for the time being. You can define this as a process outcome or balance measure just with a tap. Very easy to do. Having said that, we open the tab, find that the SPC chart, and you can do whatever you need to do this. So basic data, so the number of things that happens per month go in a run chart very easily. An eye chart is by comparison something that will take continuous data, so weight or time or something that isn't measured in such yes or no fashion. More advanced charts have lots of explanation about what you do in them. The data that we've got for the CVC infection bundle is number of infections per 1,000 CVC days. So this is the kind of thing we need. Number of falls per 1,000 bed occupied days. This is the kind of data that we're using. So we can have the explanation here. The explanations for the other charts are all similarly explained. So if you're a percentage of things, you put the chart. T&G charts plot the number of normal cases between a case where there was an infection or something like that. To clear data, then these are the ones to use. But as I said, the description under the chart is very self-explanatory of what it needs to do. And in this little I button up here, when you're in the New Charts tab, there's a flow chart that explains very nicely the way that you should be doing. the chart, the chart tells you the things that it needs to count things, and you don't need, crucially, to typing in a simple copy and paste. So in an Excel document earlier, we've got this copied. If you paste into the top row, the software makes as many rows as it needs and will stick all your information and your data in there. Scroll back to the top, give this a name, link it to measure that you had earlier, and save it. And simply as that, the software generates you a chart, which you can, as we mentioned, export it or export the chart to a PDF that you can put to a presentation. Similarly, you can edit this and say, well, it's the baseline phase. It was at this point here that we started making changes. We designate that the next phase, and you've got the distinction between your baseline and test phase. And within the test phase, you can say, well, look, April 2012, this was the point at which we added. We tried an infection prevention bundle. We tried standardising the setup of our trolleys. We had some sort of staff awareness training, that sort of thing. And if you've got those linked into PDF cycles elsewhere in the system, then you can lead these to the chart as well. It's less easy to demonstrate there, but I'll show you how we did it in the standard chart that we had. So you can see these little blue tags where we've tried things. So here, for new re-implementation of ANTT standards, you can see that happened there. Here, when we did the ANTT assessment, so you can look at this and say, this is what happened after we put these things in. Did it work? What worked? Or what didn't work? And the software will identify, places where you've been consistently good, where you've been consistently bad, and you can see where you've had outliers and question yourself and say, well, what happened here? What happened there? Were things good and were things bad? So hope it's another quick re-overview of how to put things in, which I think really one of the crucial things for getting into life, taking data that you've got elsewhere, because I'm sure you've all got it lying around, and putting it into somewhere that it can be really useful.
Brilliant. Okay. So really worthwhile just to go back over that again, because I think that's something that people really don't know. Any other questions coming through? Carol, anything else you think we need to deal with this morning?
Yeah, there's a couple of questions about from out of area if people can have access. It's been offered to all the HSNs nationally, and I think it's 8 or 10 out of the 15 have subscribed to this. Unfortunately, only control people within the Eastern and grant them access. I would suggest you contact your local HSN to see if this is available to you if you haven't heard of it before, because I know it is quite widely in use. In the number of users, without boring you on the contractual details, it's currently based on page views, and next year is going to be shifting to users. There's going to be a cap which is being negotiated, so I can't give you the actual details, but Eastern, we haven't seen an organisation going anywhere near the cap that's been suggested, so I don't think that's a concern for us at the moment with our organisations, but happy to pick that offline if anyone wants a separate conversation.
And there's another question about how to track improvements from serious incidents. I mean, I think that's a really good question. This work can be used to form your own organisation, your own trust's quality improvement plan. So one of the things that we've done at Papworth is that some of our quality improvement has specifically based on serious incidents that we've had. So by all means, this can be used to shape your QI depending on what's local to your own organisation. So if you've got a particular problem with say, sepsis or identification of the deteriorating patient, you may want to do quality improvement around that. Similarly, if you want to develop quality improvement around falls, if you want to develop quality improvement around some of the stroke or some of the serious vascular injuries, then again, your quality improvement can form that. So I think that a really useful improvement tool, what your improvement projects are, can be based on your own local organisation and can indeed be based on whatever serious incidents you are having. other questions coming through? If not, okay. Well, I think really nice to have run the webinar today. We found it helpful ourselves, actually, in organising it to help us understand the Life tool more clearly. As I said, we're not experts by any means. We're users, and we're learning. We would really encourage you to try using it, get projects onto the system so that we can learn from them, and then also get in touch with us at the Action on Frailty Patient Safety Collaborative here in the Eastern Academic Health Science Network. Tell us what you've been doing, what's worked well, and also come to us for more information about how to register for the Life QI tool. Very much for today, and look forward to our next webinars, which are coming up in January. 4 webinars coming in January. All right, thanks very much.
Thank you. Thanks so much.